Hello, everyone. I'm Deborah Elmore, Executive Director of the Bay Area Association of Kidney Patients. And today we have a great webinar on renal diets, from CKD, chronic kidney disease, once you know that you are having kidney problems, to people on dialysis, and then post-transplant. I don't know if everybody knows yet or not. You'll learn today that each of those diets is different depending on what stage of kidney disease that you're in. So if you have questions, please put it in the Q&A. I saw that chat is disabled, and we will answer the questions at the end. And let me know if there's any problems on your end. Send it through the Q&A so that hopefully I can fix it. So with that, I'm going to turn it over to Ward, and he's going to start the program.
Well, welcome to today's program on renal diets. I was very surprised along my journey to learn that there are three distinct diets and, many subsets within each of them. So we're going to talk first about the basic renal diet, then about dialysis, and then about what happens after a transplant. So we will start with Adriana Maza, who is a dietitian and board-certified specialist in renal nutrition at UCSF. Previously, she spent 3.5 years at Satellite Health. Adriana, take it away with the basic renal diet.
Can you see my slides?
Yes.
I can't.
Hi, everyone. You can see them there?
Yes.
Thank you. Hi, everyone, and thank you, Deborah and Ward, for the invitation to be here with the Bay Area Association of Kidney Patients. Like Ward said, first I'll be discussing basic renal diet, and so this is the stages pre-dialysis and pre-kidney transplant. A little bit about what we'll discuss today. We'll just talk about briefly about what the kidney does and what causes kidney disease, and then we'll get into the nitty-gritty of renal diet. But this is just mainly focused for chronic kidney disease and those earlier stages. Conditions like kidney stones or PKD, they would really warrant their own separate webinar. So this is just the summary of what actually applies to all these kidney disease stages. So just briefly, before we get into the diet, what are the kidneys and their importance with our health? And so the kidneys are two organs that are about the size of our fists, and they're roughly located like on our lower back. And one of their main, sorry about that. It is very sensitive. One of their main functions is to remove excess fluid, toxins, and waste, and they do so in the form of urine. They also help regulate or maintain our acid-base balance. So when our kidneys aren't properly working, our blood pH might be a little bit too acidic because of this toxin or waste buildup in our blood, and this is also known as metabolic acidosis. Our kidneys also help secrete certain hormones like erythropoietin, which helps make red blood cells. So when our kidneys aren't working properly, we might have anemia or feel a little bit more tired. Another hormone that they also help secrete is involved in vitamin D absorption, or sorry, they help activate vitamin D so that we can absorb calcium in our bones. So they're also involved in bone health. And our kidneys also secrete a hormone called renin, which helps regulate our blood pressure. When our kidneys aren't working properly, our blood pressure might rise. At the same time, high blood pressure also damages our kidney even more so. A little bit about chronic kidney disease in the US. And this is from 2023 data. About 35.5 million adults, or 14% of our population, has some type of kidney disease. So this is roughly more than 1 in 7 adults. Certain people are at greater risk, like people over 65 years. And this is just because as we age, our kidney function naturally decreases. Women are slightly at greater risk for kidney disease compared to men, and certain groups are also at greater risk for kidney disease. For example, African Americans are 4 times more likely to have kidney disease compared to whites, and Asians, Native Americans, and Hispanics are about 1.6 to twice as likely to have kidney disease compared to whites. People with a diagnosis of diabetes or hypertension are at greater risk for kidney disease. About 1 in 3 adults with diabetes has kidney disease, and about 1 in 5 adults with hypertension has kidney disease. So what are the most common causes of kidney disease? All of these causes are just like creating gradual damage to our kidney. Diabetes and high blood pressure makes about 2/3 of all causes for kidney disease. And this is because when sugar is not well controlled, or when we have high blood pressure, both of these situations harm the blood vessels in our kidneys. Other causes of kidney disease, if we're having recurrent kidney infections, or if we have a family history of kidney disease, like we said, people over 60 or 65 years of age, certain obstructions like prostate obstruction or birth defects. Some people are naturally born with a single kidney instead of 2. Certain drugs, especially non-steroidal anti-inflammatory drugs like ibuprofen, or certain chemotherapy as well, injury to the kidney, or having like a kidney stone, certain autoimmune diseases like lupus, glomerular disease, and kidney cancer. And so what are the stages of kidney disease or chronic kidney disease? There are 5 stages of chronic kidney disease, and these are measured based on the estimated glomerular filtration rate, or GFR. This is a test that helps us estimate like how well our kidneys are still getting rid of that, or filtering that waste and that excessive fluid. A GFR between 90 to 120 is considered a normal kidney function. Early kidney disease, or stage 1, is a GFR between 60 to 90. And here our kidneys are still mostly filtering okay, but there might be something additional that's going on. For example, we might have a kidney stone, or there might be a little bit of protein in our urine or something like that. Kidney disease is usually between a GFR of 15 to 60, and those are stages 2, 3, and 4. And once our GFR hits 15 or lower than that, that's what we call kidney disease stage 5, or end-stage renal disease. That's when our kidney is no longer able to perform its basic functions, and we might need a renal replacement therapy like dialysis or a kidney transplant. And for renal diet, like we said, this is the basics that might apply to a lot of people. However, there's no one-size-fits-all kidney diet, just because we really don't know what stage of kidney disease you in particular are, or we need to also take into account things like your personal labs, like maybe potassium or phosphorus or calcium, something might be out of range. We're not familiar with your current medications that you're taking. Some medications might increase potassium or be causing other labs to be abnormal, or some medications might also interact with certain foods that we might need to be aware of. we need to take into account other medical conditions, like maybe you have kidney disease, but you also have cancer or malnutrition or GI issues. And we also don't know your cultural or religious practices, as well as your food preferences, like what foods and foods you dislike, as well as your cooking ability and lifestyle. Dialysis and transplant centers are required to have registered dietitians as part of their team, just because that it's that important to really customize and personalize renal diet. And Medicare does cover medical nutrition therapy for chronic kidney disease pre-dialysis and pre-transplant. So if your nephrologist either hasn't addressed diet or might have said like, oh, maybe you need to change your diet, you can always ask them to make a referral to a renal dietitian. And so now let's get into the diet part of it. And so protein. Protein, we want to make sure that we're getting enough protein for health in general and to maintain our muscle mass. However, we want to avoid having large amounts of protein. Like we said, the kidney helps filter the wastes and toxins from our diet. So the more protein we're putting into our body, the more waste that our kidney needs to eliminate. And we're just making our kidneys work extra hard. So those toxins start to build up and damage our kidneys. For earlier stages of kidney disease, we would recommend a moderate amount of protein intake. For advanced stages of kidney disease, we would recommend a lower protein intake. And when we're saying a lower protein intake, we don't really mean a low protein diet. It's just a lower intake compared to the standard American diet. And the standard American diet is really high in protein. Like most Americans on average consume about 1.2 to 1.5 grams of protein per day. And really what we're recommending is to limit this intake to around 0.8 grams of protein per kilo of body weight. There might be certain people that require a higher level of protein, for example, people with diabetes, or also people with malnutrition. So it's really important to check in with a renal dietitian just to see what your individualized protein goals are. And in general, we do recommend avoiding large amounts of animal protein intake in particular, and choosing more plant-based protein options. And this is because, like we said at the beginning, kidneys help maintain our acid-base balance. So that acidity from the diet mostly comes from animal proteins, and those fruits and vegetables really help neutralize acidity. So a couple of days a week, maybe substituting an animal protein for a plant-based meal like beans or tofu or lentils can help maintain or slow down the progression of kidney disease. For sodium, eating too much sodium can cause high blood pressure. It can increase our fluid retention, swelling like edema, heart damage, and it can also cause kidney stones. And like we said, high blood pressure at the same time causes more damage to our kidneys. So any stage of kidney disease, we should really try to limit our sodium intake to below 2,300 milligrams of sodium per day. Most Americans consume about twice this amount. And if we really think about it, 2,300 milligrams is about equal to 1 teaspoon of salt per day. However, this does not mean that we have 1 teaspoon of salt to add to our meals. Most foods have sodium in them already. So it's really about getting into the habit of reading those nutrition labels and seeing how much sodium foods that we're using, that we're consuming frequently have. Overall, for things like snacks, we would recommend choosing foods that have less than 200 milligrams of sodium, or if it can even be something under 140 milligrams of sodium, that's even better. A lot of people do rely on frozen meals or prepared foods just because of convenience, and that's perfectly fine. But just reading that nutrition label and making sure that we're choosing a meal that has less than 600 milligrams of sodium per serving. And there's also many ways that we can really boost flavor by reducing our salt, like using herbs and spices, or salt-free seasonings like Mrs. Dash, using lemon, lime, or vinegars to really boost those flavors, and mostly focusing on limiting processed and packaged foods like deli meats, bacons, canned foods. Those tend to be really high in sodium. Fast foods, breads, salty snacks, instant foods like instant ramen, or salty seasonings like soy sauce or garlic sauce. For example, if we're really like things like soy sauce, we could maybe considering lower sodium. They do make like a low sodium sauce, or nowadays there's something called coconut aminos, which tends to have a little less sodium in them in general. Or when we're looking for canned soups, just really reading those nutrition labels and looking for either soups that say low sodium, or tuna fish that says low sodium or no salt added. And then preparing more meals at home with fresh ingredients is the best way that we can really control or reduce our sodium intake, and trying to limit fast foods or restaurant foods, which are much higher in sodium in general. For fluids, and again, we're focusing here on chronic kidney disease pre-dialysis. So for earlier stages of kidney disease, not drinking enough fluid can actually hurt our kidneys, because it's really going to concentrate like the amount of waste and acid building up in our body, not having enough fluids to eliminate these toxins. And that can also clog our kidneys or contribute to kidney stones, as well as urinary tract infections. So most people with kidney disease, not on dialysis, do not need to limit their fluid intake. And on average, our average population requires about 2 liters of water per day. And we really do want to encourage this to be, as much as possible, natural water. If you like things, tea or coffee, or flavored mineral water, that could also help you meet your fluid intake. But we would really try to encourage staying away from sugary beverages and sugary sodas as well. There might be some conditions that we do require a fluid restriction, however, such as liver disease, heart disease, or advanced kidney disease, and dialysis when our residual renal function, or how much we urinate, is decreased. So again, to actually be able to give like a fluid recommendation, we would also need to see if any of these conditions apply to you. And then for potassium, and potassium, I'll keep it brief, as I think this will be discussed a little bit more in the dialysis part of the webinar. But for our chronic kidney disease earlier stages, actually a greater potassium intake might help control blood pressure or reduce our blood pressure. And so there's really no need to restrict potassium in earlier stages of chronic kidney disease. And with more advanced stages of chronic kidney disease, we would only restrict if your potassium levels are actually high, like if they're on your lab results. And this is because potassium buildup can lead to heart issues. Potassium helps regulate our heart beating. So if potassium is either too low or too high, our heart doesn't like that. And mostly what we would recommend, like as a first intervention, is really focusing on problematic foods where we're having a high concentration of potassium. For example, fruit juices, sauces, or dried fruit. It's not the same eating just like one single orange versus drinking a cup of orange juice, or putting some tomato slices in a sandwich or a salad, versus consuming a pasta with a tomato-based sauce, or eating like a tomato-based soup. And I'll talk a little bit more about potassium and plant-based diets further along. For phosphorus as well, there's really no need to have like a low phosphorus diet. However, for most of the population, and this does not only apply to chronic kidney disease, but just our entire population in general, high intake of artificial or inorganic phosphorus can lead to cardiovascular disease, to vascular calcification, and to complications related to bone disease. So overall, we would recommend to really try to limit or avoid those inorganic or artificial phosphorus. And this is because our body really does not absorb natural phosphorus the same as man-made phosphorus. For example, our body will only absorb about 30 to 60% of phosphorus that is naturally occurring in foods like beans and nuts, versus we will absorb like about 90 to 100% of phosphorus that comes from additives. And so just really getting into the practice of reading those food labels. Unfortunately, the nutrition label does not require to tell us how much phosphorus something has, but you really need to read the fine print and look at those ingredients. And if you see any ingredient that has the word phos within it, then that's your cue to know that that product has added phosphates in it. For example, phosphoric acid or sodium phosphate. And those are the types of phosphorus that we want to avoid or limit. And plant-forward diets can really help us slow down the progression of chronic kidney disease. And so we would really recommend plant-forward diets does not mean like a vegetarian diet or a vegan diet, but really increasing the amount of servings of fruits and veggies and whole grains in our plate, aiming to have at least half of our plate be plant-based diets, and aiming to have about 5 servings of fruits and vegetables per day, which most Americans do not. And like we said at the beginning, because this will help this will help neutralize our pH from acidic foods such as animal foods. And old school advice was to really limit or avoid fruits and vegetables that were high in potassium or phosphorus, like beans, legumes, because they were thought that we were absorbing too much of that potassium and phosphorus. But really the bioavailability of potassium and phosphorus in fruits and vegetables and things like whole grain, like whole wheat or whole cereals, legumes, and nuts is substantially lower than previously thought, and these foods really offer more benefits than harm. And what else can we do for basic renal diet just to help preserve our kidney function? Try to maintain a healthy weight. Being overweight makes our kidneys have to work harder to remove waste. And it also increases our risk of blood pressure and diabetes. Like we said, high blood sugars harm our kidneys. So just trying to aim for a good sugar control. So if we have diabetes, trying to aim for 45 to 60 grams of carbohydrates per meal for a breakfast, lunch, and dinner, and about 15 to 30 grams per snack, as well as choosing whole grains over simple carbohydrates and limiting sweets and sugary beverages. And just for blood pressure, glucose control, and kidney health in general, if we're not doing any exercise right now, just trying to get in the habit of doing some physical activity within our limits, aiming for about 150 minutes per week or 30 minutes 5 days a week. Thank you. And I'll get it back to you, Ward, for comment section.
Well, thank you very much, Adriana. That was very interesting, particularly the last part about the plant-based diet. Totally different from what I was told, 10, 15 years ago when I was consulting dietitians about my chronic kidney disease. The next speaker is Tamara Nijmeh about the dialysis diet. She's a nephrology dietitian at Satellite Health in San Jose. She's been there for 7 years, and like Adriana, is also a board-certified specialist in renal nutrition. So tell us about the dialysis diet, Adriana. I'm sorry, Tamara.
That's okay. Yeah, sorry, I
My
forgot
bad.
to, no worries. I forgot to unmute myself for a second there. My audio's okay. You can hear me all right?
Yes.
Okay, good. So I'll go ahead and discuss some of the similarities and differences of nutrition on dialysis. You can go ahead and go to the next slide. So first I'll talk about the different types of dialysis because that also can change what is important in your diet. So there are 3 main types that I'm going to be discussing. First is in-center hemodialysis, which is typically done 3 times a week, where you go to the center and you have the staff there, nurses and technicians. All of them are there to help you with typically 3 times a week treatments. And then your access for the dialysis could be a fistula or a catheter. And so that is the one main type of dialysis. The next is home hemodialysis, which treatments can be done at home after completing a training with a home hemodialysis nurse. So you have the same type of access if you do home hemodialysis, a fistula or catheter. And one of the benefits of doing home hemodialysis is creating your own schedule, doing it dialysis in the comfort of your own home. And also the flexibility with the schedule means that you can do possibly more treatments at home if that helps with removing enough toxins and fluids. So some people can do 4 or 5 treatments a week at home, or they can do, depending on the type of machine that they're using, sometimes it's done nocturnally. So, and a lot of times, majority of the times it's done with a family member care partner. And then for one of the benefits of this type of dialysis is some people find less restrictions in their diet and fluid intake, and all of this is customizable based off of your labs, symptoms, how you're feeling on treatment. So next slide, please. And the next type of dialysis that I would like to discuss is peritoneal dialysis, which I experience as the majority of our clinic is on peritoneal dialysis. And in my clinic, we do only home dialysis. So after completing a training with your peritoneal dialysis nurse, which can take a few weeks of training, and then so with that, you have a catheter that's in the abdomen, which is used for this type of dialysis. Dialysis solution is filled in the abdomen, that cavity, and usually that's done overnight, and it's drained along with extra fluids and toxins. Again, with this type of dialysis, some people find that there are less restrictions in the diet and fluid intake. And all of this is based off of monthly visits with your nurse and dietitian and social worker. So you go in and you see the team, and then we see how you're feeling on treatment, see if there needs to be any adjustments, and then we follow up based off of labs. Next slide, please. So there are some similarities here in the nutrition recommendations for sodium. So some of the main points here is reading food labels for milligrams of sodium per serving. Again, going for that 2,000 to 2,300 milligrams per day, and avoiding added salt from condiments, high sodium packaged foods, and using all those different seasonings and herbs and spices that help add that flavor, and keeping in mind that over time our taste buds do really adapt to lower sodium, and so you get accustomed to the different flavors of the food with less sodium. Okay, next slide, please. So fluid is a very customizable per person. So your doctor and dietitian may ask you to measure how much fluid you take in a day just to help to understand what changes might need to be made, if any needed to be made. And the right amount of fluid that you take while you're on dialysis helps prevent some concerns. We want to prevent swelling, and that helps to protect your heart health. Helps prevent higher or lower blood pressure. Lower blood pressure is a symptom of not getting enough fluid and having fluid pulled off through treatments. And then higher blood pressure would be if you're taking more fluids than you need. Some symptoms of having not enough fluid from a day-to-day basis would be cramping, especially on treatment. We want to avoid the need to remove too much fluids on treatments. And then having the right amount of fluid for you helps prevent constipation. And your fluid needs is going to be dependent on the type of dialysis that you're doing, how many treatments you have a week, and the amount of urine that you're making on which your nurse and dietitian will talk to you about collecting urine. A lot of times it's done on a quarterly basis, so every 3 months, your nurse dietitian may ask you to collect a 24-hour urine collection. And all of that helps us to understand what is the right amount of fluid for you. Next slide, please. Very similar ideas here on nutrition and potassium. So your dialysis clinic where you monitor your potassium levels on a monthly basis. And sometimes it may need to be repeated if the levels are too high or too low, just to make sure that everything's safe, because as Adriana mentioned, it's important for heart health. The amount of potassium you need on your diet depends on your lab levels, and that helps us to guide us on what changes to make. Your dialysis dietitian will give you a list of choices based off your food preferences and what fits in the recommendations for your levels. So you may need to take more potassium if your levels are too low, or less potassium if they're too high. And again, this depends on the frequency of treatment and the type of dialysis that you're doing. Some examples of high potassium foods and drinks include potatoes, tomato sauce, orange juice, cooked spinach, and milk. And these foods may or may not be recommended to avoid in your diet. And just like Adriana mentioned, the more concerning foods are foods and beverages would be juices, dried fruits, because of the very high concentration, and it's easy to take many servings of those types of foods and drinks. Some examples of low potassium foods and drinks include grapes, berries, apples, and unfortified almond milk. So, next slide. And then, so phosphorus, a lot of similarities in here as well. First thing that we look out for is those phosphorus additives. Phosphorus is also checked on a monthly basis, and it's recommended to read food labels and limit or avoid phosphorus additives and preservatives. Some common phosphorus preservatives will be in colas or instant noodles. So it tends to be that the foods that have those phosphorus additives are also high in sodium. So that kind of gives us a clue that what to look out for with those packaged foods. Reading the ingredients list for phos additives such as phosphoric acid, that's an important aspect of limiting your phosphorus in your diet. Some examples of high phosphorus foods includes deli meat, colas, milk, cream soups, and cheese. So as I mentioned, reading the food labels for added phosphorus is important, but some of the foods such as and beverages such as milk won't have phosphorus in the ingredients list. So discussing your individual food intake and your preferences with your dietitian is really important, just because reading the food labels may not be sufficient in knowing which foods are high in phosphorus. So that's a good discussion with your dietitian. Some examples of lower phosphorus food options, and these foods do have phosphorus, but they also have the important protein and other nutrition that we need. So chicken, lemonade, cottage cheese, rice, eggs, fruits, and vegetables are lower phosphorus recommendations. So your doctor may give you a medicine called a phosphorus binder, and there are many different types of phosphorus binders that you can take with each meal to help lower your levels. And your dietitian, your doctor, and your team will talk with you about how to properly take the medication with your food, with your meals, how often to take it, and what to look out for with a new medicine. And next slide. So there's a monthly lab report that you review with your doctor, your dietitian, and your nurse. So these are some of the other labs that were checked on a frequent basis. We check calcium levels. So it is one thing to keep in mind with that is it's only recommended to take supplements or vitamins when it's prescribed by your doctor. If there's anything that you're interested in taking as far as a supplement, herbal supplements or vitamins, it's important to review that with the team just to make sure there's safety with your dialysis and making sure that you're not getting too much calcium or too many other nutrients. The parathyroid hormone is also checked frequently. It's usually done on a quarterly basis. And as Adriana mentioned, that there's your kidneys activate vitamin D. So sometimes it's needed to take an active form of that vitamin D, which helps keep your calcium and your parathyroid hormone levels in target. And so that's all adjusted based off of lab results. And so medications to help keep this level in target, there are a few different forms of the medicine. This, along with keeping your phosphorus levels in range, helped keep that. All of that's important for your heart and bone health. Albumin is usually checked on a monthly basis, and this is a type of protein that in your blood that may be lower if you're not eating as well, if you have an infection, a wound, or any recent hospitalizations. So your dietitian will review your recommendations on the amount of protein you need in a day. Next slide. Nutrition on dialysis. So we also want to keep in mind blood sugar levels. Your dietitian or your doctor will review how your dialysis treatments affect your blood sugar. So if there's any concerns with getting lower blood sugars after a hemodialysis treatment, then that's something you can discuss with your nurse, doctor, and dietitian, just to help understand the timing of the food. If going to treatment does affect your scheduling with your meals, we want to help kind of review that and prevent any low blood sugars after treatment. So reviewing your blood sugar monitoring with a team helps limit the number of lows or highs and helps your doctor make changes to the medications as needed. One thing to keep in mind is that peritoneal dialysis solution does contain sugar that may cause changes in your blood. Many people who have diabetes are able to do peritoneal dialysis daily at home and manage their blood sugars, but it takes a little bit of maybe more monitoring your blood sugar at home and discussing with your doctor what changes may need to be made with your medications. And so it can be well managed. So some changes in your renal diet that you may experience with the start of dialysis. Your recommended fluid intake from food and beverages as well. We also are looking at the fluid that comes from things like soups and popsicles, ice cream, yogurt. We're all looking at that as well, and that may change over time, and that's based off of the amount of urine that you make, and also the type of dialysis that you're doing. So if you're doing more frequent treatment, then you may have higher needs for fluid. And so you may not need to restrict potassium, or you may be asked to increase potassium intake, which is more common on home dialysis, especially peritoneal dialysis, where typically it's done 7 days a week, and a lot of times overnight. So you may need to monitor your carbohydrate carbohydrate intake more closely and adjust diabetes medications to account for changes in blood sugar, especially on peritoneal dialysis. And that's to account for the added sugar calories that come from the peritoneal dialysis solution. And so you may need a little bit more protein in your diet, and as was discussed earlier, it may be in comparison to what you've were taking in protein before starting dialysis. It may be a little bit more than when you initially started. So we're looking at your individual needs and reviewing what's typical for you. And again, with that, protein can come from a variety of sources. It could be vegetarian protein as well. And as you're starting dialysis, you may see an improvement in your appetite as the dialysis is removing toxins from the blood, and that helps preventing that suppression of your appetite. Again, you want to limit high sodium packaged foods. That remains important as you start dialysis to help prevent thirst, swelling, and high blood pressure. And again, these foods often contain phosphorus preservatives. Next slide. So diabetes and dialysis, we want to plan meals around hemodialysis days, which could be challenging with scheduling, but keeping snacks on hand and reviewing what types of snacks could work for you with your dietitian would be beneficial, just to help prevent those low blood sugars after treatment. And you also want to keep balanced snacks as well to help kind of stabilize your blood sugars. You want to include that protein and carbohydrate as well. So that could be something like apple and peanut butter, apple and cottage cheese, some good kind of balanced protein and carbohydrate snacks. And I guess, as I mentioned, dialysis solution does contain sugar, so and may change recommendations of your meal and snack carbohydrate intake. And your doctor may adjust your diabetes medications, the timing and our dose over time after monitoring your blood sugars as you're going from needing as you start needing dialysis. So finding time to fit in movement after a meal, such as walking or any physical activity that fits into your daily lifestyle, your routine, may help with your blood sugar. And so blood pressure on dialysis. So on hemodialysis, managing fluid intake between treatments helps prevent big changes in blood pressure from the start to the end of treatment. So that's something to keep in mind. So monitoring your fluid intake and discussing that with your nurse and dietitian to find the right amount of fluid for you is important. So your doctor may need to adjust your blood pressure medications as you start dialysis. You may find that going from pre-dialysis to dialysis that you may need adjustments in the blood pressure medications because of the fluid removal that's happening with the dialysis. And your doctor may add or make changes to water pills. Those are the medications that help you urinate to help decrease swelling and improve blood pressure. And so the type of dialysis solution you use on peritoneal dialysis will depend on your blood pressure levels before starting treatment. So part of the routine for peritoneal dialysis is before treatment, you'll check your blood pressure, and that helps you to choose the right type of peritoneal dialysis solution to help prevent low blood pressure. If you were to choose a dialysis solution that removes a little bit more fluid and also helps prevent high blood pressure by choosing the right solution that will pull a little bit more fluid if needed. So more frequent, sorry, one last, if you can go back the previous slide, I think there was one more note there. Yeah, so last point here is the more frequent dialysis, whether it's home hemodialysis or peritoneal dialysis, you may see some improvements in your blood pressure. Okay, I'm ready for your next slide. So weight. So some things to keep in mind as far as weight changes on dialysis. So you may have some weight loss with the start of dialysis if you're not feeling well, not eating as well because of the the toxins in the body can suppress your appetite. And this may also be from fluid removal as you're doing the dialysis. It's removing fluid, whether it's a peritoneal dialysis, which is usually daily, or home dialysis, which is 4 to 5, could be anywhere between 3 to 5 treatments a week, or in-center dialysis, which typically is 3 times a week. Dialysis helps relieve symptoms like poor appetite, changes in taste, and fatigue. And so your dietitian can help with meal planning to help you stay within your weight goals. Peritoneal dialysis does contain calories that are absorbed, and not all of it's absorbed, but a certain percentage of it is. And so your dietitian can help you review your fluid needs to prevent swelling and limit the need for the highest dextrose solutions that contain more calories. So that's one of the reasons why you're monitoring your fluid intake, because if there's swelling, they're using that a type of dialysis solution that has more sugar, that pulls more fluid, but also does increase calorie absorption. That's one of the things that you work with your dialysis dietitian on a pretty frequent basis. And then working with your dietitian to understand how your appetite is changing and working towards gradual changes towards your weight goal with nutrition and physical activity. And we want gradual changes over time. Next slide. So you have a monthly check-in with your dialysis clinic, and the support team will include assessing your fluid intake and how that affects your weight and blood pressure. Any concerns with changes in appetite or symptoms that come up, such as nausea, constipation, or diarrhea. All of this is reviewed on a monthly basis or more often if needed. And so you're reviewing your dialysis treatments to make sure that you're getting the right amount of dialysis for your needs. And all of this is for whether you're doing home hemodialysis or peritoneal dialysis. And with in-center, it's also making sure that you're getting the 3 times a week is sufficient for you. And then you get a monthly medication and lab review with your team. So your dialysis support team includes your nephrologist, your dialysis nurse, your dietitian, social worker, and dialysis technician, and your clinic manager. That's all I have for now.
Thank you so much, Tamara. That was a very fulsome report on dialysis and all the complications of it. Appreciate that.
Thank you.
Our final speaker is Julia Pierce, who's going to address the post-transplant diet. She spent 4 years as a clinical dietitian at Stanford, and now she's moved on to be a transplant dietitian at NYU Langone in New York City, which is where I had my transplant about 9 months ago. Julia, the floor is yours.
Thank you, Ward. Okay, I'm going to share my screen. Let's see. Okay, can you see my slides?
Yes.
Okay, great. So my name is Julia, and I'm a transplant dietitian. I work primarily with heart and kidney transplant patients, and I wanted to talk to you all a little bit about transplant nutrition. So just an outline, I'll just give you a general overview, talk about some of the differences between the renal diet and the transplant diet. I'll talk about short-term nutrition expectations after surgery, and then lifelong recommendations after surgery, and then a little summary. So just a disclaimer, this is a general overview of the post-transplant diet. It does not replace any individualized nutrition recommendations from your healthcare providers. It's always good to have individualized nutrition counseling if you need it, and some different centers may have slightly different recommendations for the post-transplant diet. So of course, always listen to whatever your healthcare providers are recommending. So an organ transplant may be considered for patients who meet certain criteria. If you're interested in a transplant, you can talk to your nephrologist about it, or your nephrologist might bring it up to you. You would need to go through a evaluation process before being accepted for a transplant, and then waiting on the transplant waiting list for your organ. The transplant can either come from a living donor, usually a relative or close friend who's a good match, or from somebody who is deceased who's elected to become an organ donor. In 2022, over 25,000 kidney transplants were performed, according to the United Network for Organ Sharing. And nutrition does play an important role throughout the transplant process. Before a transplant, your medical team might recommend a visit with a dietitian. Usually it's either for weight management, having a body weight that is optimized before a transplant can help improve your surgical outcomes. So whether that's weight loss or weight gain, your dietitian or your nephrologist might recommend meeting with a dietitian before your transplant. And then blood sugar management is also very important before a surgery. So some of those things might be recommended for you to work on with a dietitian. And then all transplant patients will receive a post-transplant nutrition education. So usually with the patient and their caregiver, the dietitian will go over all of the recommendations, and a dietitian is available to help troubleshoot any nutrition challenges that come up after discharge. So some of the differences between the renal diet and the post-transplant diet. So after a transplant, ideally the healthy kidney is now functioning much more efficiently and able to filter the fluids, phosphorus, potassium, and protein from the blood. So you may be able to have a more liberal diet. You probably will need to increase your fluid intake to hydrate your kidney, especially if you were following a strict fluid restriction prior to transplant. After surgery, you also need increased protein to help with wound healing and to just help with rehabilitation and regaining of muscle strength. And then we'll talk more about anti-rejection medicines and the effects that they can have on your health, including a compromised immune system. Because after an organ transplant, you'll have to take anti-rejection medicines that help prevent your body from rejecting your new organ. And those are medications that you have to take for life. So right after surgery, appetite might be lower, should return in time, usually within a few days or a week or two. While the appetite is low, some people will like to try and have small, frequent meals. Also, if there's any like GI distress or abdominal discomfort, the small, frequent meals may be best tolerated. Protein is key to promote healing in the post-transplant phase. And then blood sugars are usually high after transplant because of the medications that you're taking, including steroids. Especially if you had diabetes before transplant, it's very likely that your blood sugars will be elevated after transplant, and your doctors might prescribe insulin or other medications to help manage your blood sugar. And it's also a good idea to limit sweets and sugary beverages and choose appropriate carbs and appropriate carb portions to help keep your blood sugars well controlled from a dietary perspective. When the new kidney is fully functioning, most patients can usually liberalize their potassium, phosphorus, and fluid intake. Sometimes after transplant, the new kidney takes some time to wake up, and we might recommend that you continue to follow some of these restrictions, usually just for a temporary period of time after transplant until your kidney wakes up and starts functioning more efficiently and your labs start to normalize. We'll be in touch closely throughout that process. And then some lifelong recommendations. So after a transplant, as I said, you will be taking anti-rejection medicines for the rest of your life. And these medications are necessary to keep your new organ healthy and your whole body healthy, but they can have some undesirable effects on your health as well. So the transplant medications can cause high blood sugar. So it is important to still try and eat balanced meals and eat healthy carbs, limit sweets and sugary drinks. And then high blood pressure is another side effect that can happen. So it is a good idea for really everybody to follow a diet that's low in salt and limit processed foods like we heard about in earlier presentations. Still limiting your sodium intake to under 2,300 milligrams is a good idea to keep your blood pressure in check and keep your kidney and your heart and really your whole body healthy. High cholesterol is another side effect of transplant medications. So it is a good idea to follow a diet that is higher in the healthy unsaturated fats that usually come from a plant, like olive oil, avocado oil, vegetable oil, and limiting the unhealthy saturated fats that usually come from an animal. So like butter and lard and cream and fatty cuts of meat. Trying to use all oils sparingly, but when you do use oil, the unsaturated fats that come from a plant are generally more heart healthy and better for your overall health. And then excess weight gain can happen because of the transplant medicines as well. So it is a good idea to eat a generally balanced diet, eat balanced meals, exercise regularly, and avoid alcohol, not only because it's not good for any of your organs, but it also can interact with your medications and has a lot of extra calories without really giving you any good nutrition. This is a picture of a way to plan your meals to keep your health optimal with consideration for all of those side effects that can happen from the transplant medications. So it is a good idea to portion out your different the different sections of your plate. Like half of your plate should really be non-starchy vegetables. So these are most vegetables, like most vegetables fall into this category. Things like leafy greens, broccoli, cauliflower, cucumbers, asparagus, bok choy, onions, and tomatoes. The vegetables should really be half of your plate. You're going to get a lot of good fiber that's good for your digestive system and your heart, and that's good for your blood pressure. And you're going to get a lot of good vitamins and minerals from there as well. And then a quarter of the plate should be this yellow section, your grains or starches. So that's things like bread, pasta, rice, tortillas, also the starchy vegetables like corn and potatoes and peas. We want to keep the grain section to about a quarter of the plate because that's going to help keep your blood sugars well controlled. And it's always good to choose whole grains. We recommend to try and choose whole grains at least half of the time. So things like brown rice or whole wheat bread. Corn is considered a whole grain. And then the last quarter of the plate should be your proteins. So lean proteins are ideal to limit your saturated fat intake. So things like turkey and chicken without the skin, cuts of meat with the fat trimmed, things like plant-based proteins like beans and tofu and nuts. Fish is another good protein, and eggs. So this is a good way to plan your meals to keep your overall health in check. Some more lifelong recommendations after a transplant. You should always check with your transplant team before you start taking any vitamins or herbal supplements because they may interact with your transplant medications, specifically things like echinacea or St. John's wort. We would not recommend taking any of those because it can kind of like change the dose of your medicine, which can be dangerous. There's certain fruits and juices that need to be avoided because they can interact with your transplant medicines. So these recommendations might differ slightly at different institutions, but according to the National Kidney Foundation, we would say grapefruit, pomegranate, and Sevilla orange. So those fruits or the juice from those fruits need to be avoided for life because they can interact with your transplant medicines. And this is important. So because you're taking the anti-rejection medicines for the rest of your life after a transplant, they decrease your immune system. And so that puts you at a higher risk of foodborne illness or food poisoning. So it is important to make sure that foods are prepared in a way that is safe and minimize your risk of developing any kind of foodborne illness. So a few things just to keep in mind: always use food before its expiration date. Don't eat food if it looks or smells like it may have gone bad. Don't leave anything that's perishable at an unsafe temperature for 2 hours or longer. So if something needs to be refrigerated, make sure that it gets back into the refrigerator quickly. If something needs to be frozen, put it back into the freezer quickly. And if it goes longer than 2 hours at the wrong temperature, then you should just throw it away. It's not safe to use. After 2 hours, the bacteria start to rapidly grow, and that can increase risk of food poisoning. With that same concept in mind, you should never thaw something from frozen out on the countertop overnight, because then that's longer than 2 hours. So it's safer to thaw it in the fridge and let it thaw, or you can thaw it in some cold water for under 2 hours and then cook it right away. It's important to make sure that you use clean hands, utensils, countertops, cookware, and cutting boards when eating and preparing food. So don't use the same cutting board for your raw meat and then use it for your vegetables, because that's cross-contamination. Want to make sure that none of your raw meat is dripping onto anything else in the refrigerator. So keep your raw meat on the bottom drawer. And then making sure to cook foods to proper temperatures, which we'll talk a little bit more about. So more on food safety. So for your protein foods, meat, eggs, seafood must be well cooked. Deli meats must be heated. So things like turkey or salami or deli meats, there's a germ called Listeria that likes to live on those. And we want you to heat those foods before you use it until it's steaming, or until 165 degrees, to kill off the Listeria germs. If you have something like a steak or a chop, we want that cooked into 145 degrees in the middle. And it is a good idea to actually get a thermometer to take the temperature of these foods, especially when you're getting used to making sure that things are cooked to the right temperature. And then fish needs to be cooked to 145 degrees. So that means fish always has to be well cooked. No raw sushi or raw ceviche or raw oysters. Any seafood that's cooked is totally okay. Ground meat like hamburgers or meatballs needs to be cooked to 160 degrees in the middle. Eggs need to be cooked to 160 degrees in the middle. So that means no runny yolks. Always make sure that the white and the yolk is well cooked. So things like hard-boiled eggs, scrambled eggs, omelets, those are okay, but we wouldn't want to do any over easy or over medium or sunny side up eggs. And then poultry like chicken, turkey, and duck should always be cooked to 165 degrees. For dairy, milk products always must be pasteurized. So in an American supermarket, the milk is always pasteurized. But if you're buying milk from outside the country, make sure that you can double check that it's been pasteurized, or it's usually safe to make sure you're not buying milk from like a farmer's market or someplace if you can't verify that it's been pasteurized. A lot of cheeses that are soft are sometimes made with unpasteurized milk. So if you're buying any cheese, I think that it's a good idea to check and make sure that it says made with pasteurized milk, but be especially careful for the soft cheeses like brie, camembert, blue cheese, queso fresco. Those are often made with raw milk. So there are certain brands that may use pasteurized milk, and those ones are okay, but it's important to check. And then for fruits and vegetables, raw bean sprouts and alfalfa should be avoided. So bean sprouts and alfalfa must either be cooked or avoided if they're raw. And then all produce must be washed. So rinsing with water, running water from your sink is sufficient. You don't need to buy a special vegetable wash or anything like that. But do make sure that any produce is well washed, even if it says that it's already been washed. It's important to make sure that you wash it at home as well. So in summary, healthy nutrition is an important thing to consider before and after transplant. And dietitians are available throughout the transplant process to provide education, answer questions, and help you meet your goals. And dialysis centers have dietitians available. So there are people to help you, and you can always ask your doctor for a dietitian referral if you're interested in individualized nutrition counseling.
Thank you, Julia. That was a very comprehensive presentation as well. Let's move on to some questions. We have a number of them from the attendees. First one, I'm not really sure this is a dietitian question, but let's see if it is. Is it really safe to have MRIs with contrast now versus in the past? And if so, are there different types of contrast that are safer than others? She says she has a cyst on her transplanted kidney and has been advised in the past not to have an MRI with contrast. Are there other ways to determine if cysts are cancerous or not? So perhaps this is best addressed to Julia.
I unfortunately do not know the answer to that. I'm sorry, but I think that sounds like a question that would be better answered by your doctor.
Okay, next question. Are there foods or herbs that may help to decrease a cyst on the kidney? And which vitamins would be supportive for transplant persons, particularly regarding fatigue? I guess that's two questions.
I can take the first part. And so polycystic kidney disease, we would recommend a ketogenic diet. Cysts are dependent on glucose or sugar intake. And so a high-fat ketogenic diet has been proven to shrink the size of the cysts as well as prevent further cysts from forming. But that in itself, I think, like I said at the beginning, kidney disease is so big that things like polycystic kidney disease or kidney stones, I think they would warrant their own webinar because it's more than just ketogenic diet, but basically, yes. And not any like particular herbs or spices that would help shrink the size of the cysts.
And what is a ketogenic diet?
A ketogenic diet, so that's, like I said, that's a high-fat diet. It's like higher in fat, lower in carbohydrates, and lower in protein.
Okay. And Julia, which vitamins would be supportive for transplant persons, particularly regarding fatigue?
So regarding fatigue, I usually only recommend supplementing vitamins or minerals if there's concern for deficiency. And if there is concern for deficiency, I usually will actually recommend to have those labs checked to assess supplementation needs. In general, for fatigue, I think there's other nutrition strategies, like just making sure that you're getting enough calories and enough protein, enough hydration. Those are the kinds of things that I would first assess if a patient was having fatigue.
I had a somewhat broader but related question, which I think goes to all three of you. That is whether diet can relieve CKD symptoms like fatigue, skin rashes, leg cramps, swelling. And, I guess follow up to that is, does it depend upon the individual?
So I can kind of discuss the swelling. The low sodium diet would help with the swelling. Also, monitoring blood sugar to make sure that's high levels of blood sugar can also cause thirst and lead to increased hunger. From high blood sugar and low blood sugars can both cause hunger and maybe cause some higher intakes of sodium and fluid and higher blood sugar. So that's some things that I would take in consideration when it comes to those symptoms. And you said this is just kind of overall CKD diet, not on dialysis. Is that correct?
Yes, because people in the BAAKP Sunday meetings frequently raise questions about those kind of annoying symptoms that I listed, and I thought it would be helpful if any of you know whether there are specific dietary issues that can help alleviate those symptoms.
You
Like
mentioned itchiness as well.
Itching. Yeah.
itchiness, I should have mentioned that, right? I said skin rashes, which is
Oh.
related to that.
Because sometimes itchiness can also be if there's like a high phosphorus levels, but also there are other pathways that are not fully understood of why kidney disease also causes itchiness even if your phosphorus levels are within normal. So if you do have itchiness and a high phosphorus level, then that's where maybe I'm really looking at those foods, reading those labels, see if they have any hidden phosphates within them, restricting those, see if that helps.
Are all these symptoms really related to the decline in EGFR that you have as a CKD patient? I mean, it seems logical that if your kidneys aren't functioning, that the toxins are going to fall down to the lower part of your body and cause the swelling, skin rashes, itchiness, cramps.
Yes, like we said, at the beginning of the webinar, like part of what our kidneys are doing is eliminated that excess fluid. So if there is kidney damage, they're not able to remove that excess fluid as efficiently. We might see some water buildup or edema. And you also said cramping. So remember that our kidneys are also involved in maintaining the homeostasis or the balance between the minerals and electrolytes in our blood, like magnesium, potassium, sodium, calcium, etc. And so where some of those levels start to build up, cramping can also be one of those symptoms. But we would also, there could also be other reasons why a person is experiencing these symptoms. So it's also a case by case.
Thank you. The next question from the attendees: is it true that after transplant, one can drink too much water?
Anybody can drink too much water. So that I suppose that is true. It depends on your kidney function. So your team may give you a specific fluid goal. If you're drinking like far too much water that you're becoming overhydrated, then that can be dangerous. It's less common if your kidney is functioning properly, but just being generally well hydrated with like 2,000 milliliters of fluid a day is usually sufficient for most people.
Okay. Now, Adriana, one of the attendees asks, for someone who's stage 4, are there tips or suggestions that one can use for personal meal planning?
So the picture that Julia showed of the plate with half of our plate being vegetables, a quarter of a plate being carbohydrates, and a quarter of a plate being proteins, that would also that's a good visual aid to help balance or design a meal. Overall, for chronic, for stage 4, we would really want to focus on making sure that we're not eating too much salt, that we're not eating too much protein, trying to limit to those 0.6 to like 0.8 grams of protein per kilo, and just really making sure that we're getting enough fruits, vegetables, fiber within our in our diet. For meal planning in particular, I don't have any tips. But maybe afterwards I can also send a good link to useful pages with recipes and other meal planning resources for your attendees to have.
I was wondering if there's maybe a link to some article or publication that helps you arrange or do your meal planning.
Yes, there are plenty of resources from the National Kidney Foundation, the National Kidney Diet, or the Renal Dietetics practice group. So I'm happy to share some of those resources with you to share with your attendees as well.
And could you comment on, you referred to a goal of 5 servings of fruits and vegetables a day. How does one know what a serving is?
Yeah, overall, maybe not trying to focus as much as like serving sizes, but working towards making sure that that half of our plate really is made up of vegetables or some fruits. Or if you overall are looking at your own diet right now and you're aware of like, oh, yes, I really don't eat any fruit in a day, or I might just eat one fruit a day, just working on increasing those portion sizes gradually.
Okay. Next attendee question is, the attendee saw an infomercial that indicated that brown rice is just as bad for a person who has diabetes as white rice. Is that true?
I can answer that if that's okay. So brown rice will also raise your blood sugar. It does have added nutrients and it's going to have a slower blood glucose rise. But just as you would with white rice, you want to measure, kind of monitor the portion size and see how that affects your blood sugars. And then just and look at what you're eating it with. Does it have that fiber and the protein that you need to kind of help manage the rise of the blood sugar? So just as white rice would increase your blood sugar, brown rice will as well. So we want to measure portion size and balance it with fiber and protein and some healthy fats as well, just to keep it all balanced. Do you ladies agree? Yeah, okay. Hopefully that answered the question.
Tamara, another question comes up from
Sure.
the questioner says, I've heard from persons on dialysis that they need more support for diet, such as more support than what Medi-Cal or Medicaid may allow. What do you suggest that a person can say to request one-on-one support?
So in my experience working in dialysis, I work mainly in home dialysis, but I also do some in-center dialysis. The support is usually a monthly call with your dietitian, and there's not a limit to the time that you can take with your dietitian. If there's any issues that kind of come or questions that come up in between visits, so if it's in the center, you're gonna be there usually 3 times a week, and you can see the dietitian and request to see them during your treatment days. And then if it's a home hemo or peritoneal dialysis, there's monthly clinic visits and usually a phone call after that to follow up on labs. And there's typically not like a time limit on or number of times you can speak with a dietitian. But if there's kind of time restriction on scheduling issues, then you can ask the dialysis dietitian for resources. Just like Adriana mentioned, there's National Kidney Foundation resources and Renal Practice Group resources, so they can help you give you like supportive resources to use on your own at home, and then follow up with them at the center or by phone or in the home dialysis clinic. So there's not because the dietitian is working in the dialysis centers, they're on a frequent basis, whether they're part-time or full-time, they're usually there often. There's not a time limit, just scheduling and working with the individual.
Another questioner says she's finding it hard to lose weight on hemodialysis. And do you have any suggestions to help?
I have a few suggestions. So with that, talking with your dietitian about what specific weight goal that you have, and then working with your nurse and dietitian to kind of address how much of that is any fluid concerns on hemodialysis. And then making a goal, a lot of times weight loss can be frustrating because it feels like it's not happening as quickly as you like it to happen. So we want to kind of measure how the changes are happening over time, and the safest and the best way to lose weight is gradual over time. So kind of addressing, how what, and setting a goal with your dietitian, not just a weight goal, but how many pounds of weight do you want to lose in a month, just to kind of help keep tracking. So that's one thing, is tracking is important, because initially we're having changes that we may not recognize, changes in our body composition, or we might be losing a little bit of, we might having less fat weight and more lean mass. So, and that's like kind of the way our body changes over time with how we're eating. It's not always shown on the scale. So we want to just kind of look for initially, again, it might be frustrating at first because we might not see the changes right away, but it's patterns that we change in our diet and our exercise over time that are going to be kind of gradual changes. So that's one thing, is knowing, setting a goal, working with your dietitian on how many pounds you want to lose in a month. And so that, and then also that the plate method that Julia brought up is really helpful for, all types of people. So that helps us to focus on adding fiber, which is filling, the right amounts of healthy fats that are also going to be filling, protein, and then working with your hemodialysis dietitian to know what types of fruits and vegetables are going to fit into your diet. And also kind of looking into those hidden calories, that we can make those small adjustments that are going to help us lose, kind of cut out 100 calories here, 100 calories there, just small adjustments so that you're not feeling deprived. So whether that's, decreasing, avoiding added sugars and drinks, that can be a couple 100 calories there. Measuring out condiments that are higher in calories, sauces, dressings, to kind of help cut an extra 100 calories there. And these slight adjustments will decrease some calories and make little changes so that you're not feeling deprived. So hopefully that helps.
This raises a related question that I've been wondering about recently. I've heard that post-transplant, people sometimes have a reduced metabolism rate that makes it more difficult to burn calories. And perhaps the same is true of people on dialysis. Julia and Tamara, do you have any thoughts on that issue?
I know that the anti-rejection medicines can cause undesired weight gain, so it can be harder to lose weight after a transplant because of those anti-rejection medicines. I don't know exactly if the actual basal metabolic rate is changed, or if it's like the medications that make it harder to achieve weight loss.
Tamara, is that an issue on dialysis patients?
Yeah, so one thing that was thinking about with that question as well is that if there's some concerns with fatigue, that kind of can be challenging, and that also can happen with higher blood sugars as well. So managing blood sugar can help it to be a little bit easier to maintain weight as well. So, and with that, so managing blood sugar is a concern as well on hemodialysis. And then fatigue, when it comes to that, something to keep in mind with that is kind of exercise is also recommended for, managing blood sugars and maintaining weight. So, and I know that could be challenging with hemodialysis scheduling. So kind of keeping in mind that you can break up your exercise throughout the day and it doesn't have to be all in one chunk. So hopefully that helps with kind of adding in that physical activity.
Julia, another attendee reports weight gain after transplant, after changing the diet. It says, after taking Monoharo, not sure what that is, I've lost weight and is wondering if the kidney meds may be causing weight gain. I think you commented on that, but what is it about the kidney meds or the transplant meds that would cause weight gain?
Is it Mounjaro that patient is talking about?
Mounjaro, that must be it.
Yes, that's we're seeing a lot of those GLP-1 medications used for weight loss now, and they can be very effective. So that's something that the transplant team thinks about in patients who are pre-transplant and need to lose weight, or patients who are post-transplant and have a goal of losing weight. So that's something that we're seeing a lot more of now. And with the actual transplant medicines, I think that I'm not sure exactly how the medicines cause potential weight gain. I think it's something that I'm not super familiar with. So sorry, I'm not sure about that.
Okay. What's better before and after transplant, wheat bread or white bread?
So
Adriana, any thoughts
yeah, I'll let Adriana
on the
talk.
pre-transplant?
White bread or wheat bread. I mean, kind of like what Tammy was commenting about the brown rice and white rice. So pre-transplant, yes, the whole wheat bread might have a little bit more fiber, more phosphorus, potassium, magnesium, other nutrition value, maybe a little bit lower glycemic index. But it's also like the amount of as a carbohydrate in general. If we're talking about glucose control, we would count one slice against one slice as a portion of carbohydrates. So also, if you do enjoy white bread pre-transplant, it's okay, as long as what are you combining it with? And then post-transplant, that would be Julia.
Any thoughts on that, Julia? White versus wheat?
Yeah, I think I usually tell people to try and have whole grains at least 50% of the time. That's what the American Heart Association recommends. But it is important what you're pairing your carbs with. So if you're having some white rice with some vegetables, you're getting a lot of good fiber from the vegetables, and certain dishes are better with one or the other. So I understand that as well. But kind of just choosing a balance is important.
Is anyone aware of studies about transplant recipients taking Mounjaro, the effects of Mounjaro?
I am not familiar with any studies that exist currently, but I think this is a really interesting topic. And I think that as we start to see more of these GLP-1 receptor agonist drugs used, we're going to start seeing more research about the effects. And I think that will be very interesting to review. So I assume we'll see more of that in the future.
If I understand correctly, Adriana, you indicated that you don't need to worry too much about potassium if you're on a largely plant-based diet. I wonder why that is, and I also if Tamara and Julia agree.
If you're mostly eating, so the amount of potassium from natural occurring sources like vegetables, fruits, legumes, nuts, we're only going to absorb a small amount of that potassium, like 30 to 40% of that potassium. And it's also coming in a food that is high in fiber and has many other nutrition benefits like minerals and vitamins that are good for our body. Versus that's not the same as potassium found from artificial potassium, like potassium chloride or potassium citrate found in ultra-processed foods that are very easily available and just go straight into our blood, and we're absorbing about 90 to 100% of that potassium.
Tamara, I see you nodding. I agree. I
Yes,
assume
I
you
agree.
agree.
I do agree.
Julia,
Yeah.
if you agree as well.
Yeah,
Okay,
I
we are
do.
now,
Sorry, I
excuse
just
me.
want to add one last. So, yeah, and that's when you had mentioned the artificial potassium. I also, make sure to point out that people should read it out in the labels, like for salt substitutes. So they a lot of times they'll have potassium. And then, like you mentioned, Adriana, just earlier, just avoiding those high potassium juices and sauces. Those can be a concern, but overall, and then also in my experience, making sure the person is getting the right amount of dialysis is very important for potassium. So that's the first thing I look out for. Are they getting the right amount of dialysis? Are they getting the right amount of treatment? And then are they taking in these really highly concentrated potassium drinks usually, or dried fruits? So yeah, that's why I wanted to add.
And there might also be like other additional reasons why potassium is high. It's not only our diet, like Tamara said, like maybe they're cutting treatment time short, they're skipping treatments, but also maybe they're constipated. One of the ways that we eliminate potassium is through our bowel movements. So if we're constipated, we might see high potassium levels, as well as certain medications might also be increasing our potassium levels. So we need to look at the whole picture before reaching the point of restricting fruits and vegetables, fresh fruits and vegetables.
Okay, this has been a great session. And I think we've run over our time slightly, but I wanted to thank all three speakers for really a great show. Great, very informative. I learned a lot, and I'm sure all of our attendees did as well. Thank you.
Thank you for having us.
Thank you.